Hey, the next time that you get a mammogram, you may notice some changes if you haven't already, because a new FDA rule aimed to help reduce delayed cancer diagnoses just took effect this week. Now, all mammography reports and results letters sent to patients must include an assessment of breast density. Joining us now to tell us how these changes could impact you is the Chief of Breast Imaging at UTHealth Houston, Dr. Claudia Cotes. Good morning, Doctor.
Good morning.
Thank you so much for being with us.
Thank you for having me.
Such an important conversation for women and those who love, their mothers and their grandmothers, that they need to know about these regulations. So tell us about these new regulations. What exactly are they?
So basically what we're required to do by law is send a patient letter telling the patient what their breast density is. And breast density is very important. It's something that we're able to see in the mammogram only. And it's going to determine if the patient has higher risk of breast cancer. It does increase the risk, but most importantly, it's going to tell them that their mammogram may not be as sensitive as it would be for somebody who doesn't have dense breast tissue.
Okay, and we're talking about sensitivity as maybe finding a lump or seeing something on the image that maybe you wouldn't have seen before.
Exactly. So what happens with breast density is that your mammogram is going to look more white in the images. Cancers can look white too, so it makes it very hard for us to determine if there's something hiding in that tissue. So for these patients, it's very important to know that, because they can advocate for themselves and try to get additional imaging, maybe like an ultrasound or an MRI, that will improve the overall way we can see the cancers for them.
Okay, and the key is to find those cancers early.
Exactly. The earliest you can find a cancer, the better the treatment is going to be for the patient. And unfortunately, if you have dense breast tissue, you not only have increased risk, but it may be harder for us doctors to see it.
It might be hiding.
Exactly.
Right. Okay. So if you do get that notice, or you do get that diagnosis that you do have dense breast tissue, not something to really worry about right away. It's just something to be informed about.
You just have to know that that's part of your normal body. I mean, you can be dense, you may not be dense. There's nothing you can do about that. But what you can do for your health is tell your doctor, hey, I know I have dense breast tissue. What additional studies should I be getting to find breast cancer earlier form?
Okay, so if you do have dense breast tissue, what is the plan now? If you find out, so you get a mammogram, should you schedule them together with the ultrasound, the MRI? How can you go about it?
Exactly. So what we're doing is that if you have that letter, you know you have dense breast, you tell your doctor, they're going to send you back to us with a letter, with an order for a mammogram and an ultrasound for screening, so we can do both on the same day. Also, depending on your risk, let's say you're a higher risk patient, family history, or other things that can increase your risk, they can also send an MRI for you. So overall, you're going to get better checks.
And I've been through the process. Many women have been through the process. It's not something to be scared about, and it doesn't hurt, and it's kind of quick if you can get in there and know what you're getting.
Yeah, I mean, it's necessary actually, because it doesn't really make sense for women to know they can have higher risk and their mammograms are not maybe as good as it would be for others, and then you can't do anything about it. Now we're telling patients, yes, you can do something else about it that would make your health overall better. And the important thing for us now is try to advocate for insurance companies to cover for those tests that women need.
Right, that is the next big step. At what age should women start maybe getting a mammogram? What is the
40.
key age? Okay.
So 40, that's the key age. It also depends if you have family history. Let's say your mom had breast cancer when she was younger, you have to start 10 years before she
10 years
had breast
before.
cancer. So let's say your mom had breast cancer at 45, you would start at 35.
Okay.
So that's important to know. But 40 for sure, every single year.
Okay, so if you have dense breast tissue, nothing to really worry about. It is natural. A lot of women have it. Isn't it like 60%, a high percentage
It's like
of women?
almost half.
Yeah, have dense breast tissue.
Yep.
You just have to be knowledgeable about it and
Exactly.
know.
Knowledge is power.
Knowledge is power. Exactly, exactly. All right, doctor, anything else that you want to let our viewers know about?
Well, October is coming up.
Yes.
So if you haven't scheduled your mammogram, this is a great reminder for women.
Yeah, got to do it. It's painless and it's quick and it's going to catch things a lot earlier, because that is the biggest key.
Saves lives.
Yes. All right, doctor. Thank you so much for being with us.
You're very welcome. Thank you for having me.